Trying to be positive. We are back in action. We have a different type of podcast for you today. It's summer break. I had to bring my kids to work. So here we are trying to make the best of it. I'm kidding. It's all planned. Thankfully, we have an expert in the house, Dr. Tara.
Hi.
From the Poppy Clinic. And she runs a variety of programs, which she will explain to you in depth with regards to teen health, trying to understand them, analyze them, figure them out. But also, I thought that this would be a really interesting podcast because I find I deal with women who are trying to become pregnant.
Yeah.
And I'm always astounded that the basics of puberty and then hormones, menstrual cycles were never adequately explained.
Never.
I had a patient today who I had to explain to her that her fallopian tube was not actually attached to her ovary.
Yeah.
She had no idea. And so, I had to sort of like recalibrate my explanation to her because she couldn't understand how, a follicle on the opposite side of the ovary might actually be able to successfully ovulate into the fallopian tube. And I had to explain it was more of like a catcher's mitt as opposed to
like that.
Right?
Yeah.
Like as opposed to like an engulfed
Totally.
tube-like structure.
Yeah.
And I was also trying to explain to her how retrograde menstrual flow worked, and she couldn't understand how it could possibly escape the reproductive system if it was in fact a closed system, to which I regrettably had to inform her it was not. So we're hoping to catch this at a younger age.
Absolutely.
But I think it's going to be applicable from like 10-year-olds to 40-plus-year-olds, this conversation.
Absolutely. Well, thank you for having me. I'm really excited to be here. And I totally agree, right? For a lot of females, the only time that we really think about these things is if we're struggling to conceive. We're really not taught these things. And girls aren't, there's health education in schools, but it's lacking in a lot of way, right? So I love talking about puberty. I absolutely love it. I think it's so much fun. I think it's so empowering for girls to really understand their bodies. So many girls that I work with are scared. They're scared of getting their period. They're scared of that unknown. Like puberty has really bad PR, like really bad, right? So girls are terrified of what's to come. And I think having these conversations is so incredibly empowering.
This is the thing. I looked up a video on YouTube because I wasn't sure when these two little lunatics were going to get their periods. And so at the age of 10, I was trying to find them adequate resources because they don't want to listen to anything that I have to say. They're actually astounded that anyone listens to me at all. And so I was trying to find them adequate resources.
Yeah.
And I used a public health resource from the Canadian government. I think it was like intended for schools.
Yeah.
And it was terrifying. It was like it just listed out symptoms. It didn't list out what actually occurs or why. It didn't highlight the importance of ovulation, which then leads women later in life to think that if they're on the pill, that their withdrawal bleed is in fact their period.
Yep.
And then it listed out this like a terrifying plethora of hell that is to infall them each month. And it, like you may have to miss school.
Yeah.
It's normal to be on painkillers. Hot water bottles are going to be your friend. You're going to crave chocolate. It's like, what kind of a monster are you going to turn into?
Totally.
And also, how fragile are you? You're going to have to take a time out?
Yeah.
That's normal? And then I frightens me because you have all these endometriosis patients where they would have listened to something like this and then been gaslit. Like, oh, this is totally normal.
I think that's such an important piece. Because nobody's talking about this, a lot of girls and a lot of parents don't really know when to worry. I remember I had severe menstrual cramps when I was young throughout all my teen years. And my mom didn't know that that was not okay. She was like, just keep taking those painkillers, keep taking them, right? And nobody really is teaching us this. And so we normalize a lot of these terrible symptoms that shouldn't be normalized.
Yeah, dysfunction.
Yeah,
Yeah, and then it just worsens with age.
totally.
Tell us about how you got into this, your background. I want to know about it all.
Yeah,
let's
okay,
go.
let's get into it. So a few years ago, I co-founded a company called All About Mental Empowerment. And we work with schools. So we provide mental health education in the school system. So we mostly work with the Peel Board and the Halton Board. We've worked with over 70 schools, more than 25,000 students in just 2 and a bit years. And it was really through that work, doing all these presentations, talking with kids all the time and their parents, that I really fell in love with this age group. And it was especially in working with their parents. So we mostly talk about mental health when we do these workshops. But as I was doing more and more of these parent workshops, I was just really realizing that parents are really struggling to talk to their kids and have challenging conversations. So mental health is one of those things that can be really challenging to talk about, right? A lot of parents today didn't grow up with adequate mental health education. And so having these conversations feels impossible, feels scary. And yeah, it was really just the more that I worked with this population, I realized that I wanted to take it a step further and really support parents and their kids in a larger capacity. So as you mentioned, I work at the Poppy Clinic and we run a lot of programs there. And so Michelle and I started working on a tween program. And so I went ahead and designed all of the content for that. And so now I run a program that's for moms and daughters. So it's a 6-module program, and we go through lots of different tween health topics. So essentially, the program is to give girls all of the education about puberty in a setting that is comfortable as well as evidence-based. And then really to give parents the language to continue these conversations at home, right? Like it's hard, home life is so busy, right? In the hustle and bustle of life, how often are you stopping and saying, well, this is what a period is. Let's sit down for a moment and talk about all these things, right? And maybe you're having these conversations as a healthcare provider.
I'm relying on you too.
Yeah.
I'm relying on you too.
And it's like these conversations aren't happening. And so then girls feel stuck. And I think too, when we're not creating this foundation with girls early on in their life, when we're not the ones having these important conversations about puberty, then when things go wrong with their body, they don't feel comfortable turning to their parents because that foundation isn't set. That intimacy in the relationship where they can talk about their period or weird changes going on in their body, it's not a safe space to do that. And I think that it needs to be, right? Parents need to be the ones facilitating these conversations, even if it feels awkward, even if it feels uncomfortable. So that's what I do, and that's what I love to do.
I think it's also key because it really can create a stronger relationship with your child beyond just explaining your period.
Absolutely.
I know for myself, like my mother and I love my mom, but she and I would never say that we're close.
Mm-hmm.
And I think a lot of that, she was a very good parent up until I became more of an adult.
Mm-hmm.
And then it became a challenged and strained relationship because she just didn't know how to adapt with me in this new role.
Yeah.
So by the time I had a teratoma that crushed my ovary, she genuinely, I'm at this point, I went downstairs and I was lying on the floor and you could see this grapefruit sized mass. I was like, there's something most certainly wrong with me at this point. Like all of these times that I had been complaining, about my period and how uncomfortable I was and how I couldn't function. And it was sort of like, oh yeah, we all go through this. Don't worry. To that moment where she was like, you have to be straight with me. Are you having sex with your boyfriend? Because this is probably an ectopic pregnancy.
Right.
At which point now I look back and I'm like, I would have been dead
Mm-hmm.
if I had developed like a 20-week fetus in my fallopian tube,
Yeah.
which was the size roughly it would have had to have been. So, and at that point, like the trust relationship was definitely severed.
Mm-hmm.
And I think it's probably like she didn't have these conversations with her mom.
Yeah.
Like it just wasn't part of like culturally appropriate.
Yep.
And also just not part of what they were used to in terms of their relationships. And so it's important to me that we are open and honest. But I mean, this could be like a workshop even right now, because I would definitely say I don't have the parenting skills that I would like to while dealing with them and their health. This one specifically is a hypochondriac like me, so I never know if what she's actually feeling is relevant or not. Because, you know, like I'll go from having an eye floater to like a brain tumor in a hot minute. So she's very similar, like we just discussed about amputating her ear due to what looks to be potentially a scratch. So we'll introduce you guys now. We'll start with you, my little hypochondriac. What is your name, your horoscope, and anything else that you find particularly interesting and identifiable about yourself?
I'm Aiden. I don't know what a horoscope is.
Oh, your astrological sign.
Oh, a Cancer.
Yeah.
Okay. Yeah. I'm 13, and I love monkeys.
Love it.
Great.
I'm Maddie. I'm also a Cancer. I'm happy lots of the time. I'm 12. I like cows. I like reading historical fiction. And I like school. I know, what a surprise.
No, that's great. I like how you guys have identified yourselves with the animals that you like.
Yeah, that's very cute.
It's nice. It's nice. Okay. She did have a lot more to say, which is kind of shocking. I was no, you can't. You're just burning right now, aren't you? What do you want to add, Aiden?
Okay. I love reading books. I really like math. I love my school.
You're just trying to one-up me.
There. This is getting out of hand. All right. Okay. So if you were heading into a school that was filled with this age group, how would you start the conversation around menstrual health, and how would you explain it to them from the get-go? Like,
did you say mental health or menstrual?
Menstrual.
Menstrual. Okay.
Yeah.
I wish I could talk about this stuff at school.
Can you not?
There's a lot of red tape in schools. Yeah.
That's nuts.
Yeah. So we just focus on mental health at school.
Oh my
God. Yeah. But let's do menstrual health. What have you, actually, I'm curious. What have you learned about in school when it comes to puberty, periods, all of that? If anything yet.
Well, during school we did have this huge like circle about being a girl, but it was like kind of more around mental health.
Okay.
We also learned about like periods and puberty, and how like getting pain is normal, and that we should bring pads to school in like our older ages.
Okay, great. How did you feel when they had that conversation? Did you leave that conversation feeling excited, nervous?
I definitely was not excited.
Okay.
Because I've heard many things where like they say like, oh, it's going to be horrible. That's what my friends say, because they've already gotten theirs and I haven't. They are always asking each other, do you have any Advil to spare?
Are you serious?
Yes.
Like little tokens? Any Advil? Advil, please help me.
Exactly.
This is the drugs that are going around your school these days?
Oh, I guess.
Oh my God. I mean, I guess it could be worse, but seriously, Okay, what about you? Your whole school is filled with girls.
Yeah. I'm not as nervous because there's no boys that are like freaking out about it. At my old school, they were all like at health class, they were all screaming at something weird. And I was like, okay. I was the only person that actually was looking forward to health class because I wanted to learn more and I wanted to go into the new journey. And at my school, I'm not very nervous because I know that if I say something like I had my period, everyone had it before, and I know they're going to have it, so I'm not as nervous. All my teachers are like, they're think it's fine that everyone's gonna have their period. They don't talk about like the pain or anything. They don't talk. They're just like, you're growing up, you're gonna be fine. And so I'm not nervous at all about it. Like in my old school, I was sort of nervous because everyone was making it up as a big deal. But in the school with all girls, I'm feeling much, much better because like everyone else is like, oh, you'll be fine or something, or like, it's okay. I was nervous about it too, but it's not that bad or something like that.
Interesting.
Awesome.
So in the absence of boys,
Mm-hmm.
your period is not stigmatized.
I'm not worried.
Very interesting.
Okay.
This is actually something that I touched on a lot when I talk to parents about this. And this is why I really emphasize the importance of having these conversations at home and not relying on the schools to have them. Because especially in a co-ed setting, if the boys are laughing or snickering or making little comments, right, that can make it pretty uncomfortable for a lot of girls in the class. And sometimes when all that's happening, girls can kind of shut down and not really listen to what's being taught because there's shame in the room, right? And so I think we can't just rely on what's being taught at school. And again, it is so important that we build that foundation with our kids to create that safety and intimacy and trust in that relationship.
So you're saying I have to do the work.
You totally do.
Oh my God.
But I will help you.
Oh my God. Okay, all right. Let's go. Let's do this. How do I start?
Yeah. So I think that the first place that we should start is before we even talk to girls about any of these changes. I think the parent, whether that's the mom or the father or whoever is going to have these conversations with their kids, needs to take some time to reflect. And I think that this is really important because a lot of us we still carry some shame from puberty. I mean, when I think back when I got my period, my mom said, I got my period. I was so nervous to tell her, like so scared, so embarrassed. I don't know. And then I went to her and I told her and she was like, well, this means you can get pregnant now. I was 12. I was like, what? What does that mean? What does that mean? What is that? I have no idea.
Right.
And it really shut down the conversation.
Yes.
And of course, she was trying her best. But I think as parents, we need to just take some time and reflect on our own experience during puberty. So what were the things that were helpful that were taught to you? What were the things that were not so helpful and that maybe you want to let go of? And also taking some time to acknowledge if there's any grief coming up for you, which comes up for a lot of parents at this stage. A lot of parents are feeling like, during these tween years, their daughter's starting to pull away from them a little bit. She's starting to change in some ways. And for a lot of parents, that comes with an element of grief that a lot of parents have to process and work through so that they're not bringing that into the conversation with their kids. So I always say that that's the first step. So take some time, maybe journal, just start to think about these things so that you can create an experience and have conversations that are really, really intentional with your kids.
Right. Okay. All right. I can do that.
Yep.
I can, for sure. I genuinely, I would definitely have a different approach, I think, than your mom.
Yeah, I hope so.
Although I like that. I do love a good shot of fear.
Yeah. It was confusing though.
Where it's like appropriately placed.
Yeah.
Like, okay, great.
Yeah.
But I wouldn't use that one only because I think that statement alone is what has put my patients into such an expectation versus reality, like shut down.
Mm-hmm.
Because the expectation is that you have your period now, you can get pregnant, don't have sex.
Yeah.
End of story.
Yeah.
So they assume, okay, now I am having a lot of sex.
Mm-hmm.
I am not pregnant. What is wrong with me?
Totally.
So it also sort of spins it around this idea that like your period is less about you and more about a process.
Yeah.
Or more, your value
Mm-hmm.
as somebody who could potentially bear a child.
Yeah.
Like as opposed to an individual. You know what I mean? Yeah. What do you think about like your observers in our house? Like I don't have any symptoms when I have my period. So like I don't have any cramps or nothing changes for me. The
Mhm.
only thing that's different is that I have to obviously use tampons and the occasional cup, but for the most part, it's pretty nondescript. I don't think that they would have any idea that I even had a period. Do you have any idea?
Yeah.
How do you know?
I can only tell when I see bloody tampons in the trash.
Great. Thank you, audience. Ryan, are you going to throw up over there? You puking in the corner? Okay,
Just
cool,
saying.
cool. We're going back to Maddie.
Just saying. Sorry. What was
And that's it.
Yeah, that's pretty much it.
Yeah.
Like, I don't hear you being like, oh, I have grabs, cravings.
Right.
Cravings.
Yes. I think that's because I use my period, and I sound very sanctimonious, but I use my period as a barometer
Mhm.
of my overall health.
Yeah.
And then make, tweaks
Mhm.
accordingly, be it with acupuncture and or like
Yeah.
nutritional supplementation and or more fluid, less fluid.
Yeah.
More exercise, less exercise, more sleep, less sleep, etc.
Mm-hmm.
and so forth. I can't imagine having less sleep, or how that would benefit me, but you get the picture.
Yeah. And it is a marker of our health. And that's something that I counsel parents on a lot too, is if their kids are particularly nervous or anxious about getting their period, talk about it as a metric of health, right? This is like the way that a lot of girls hear about periods is, oh, it's gross, it's scary, it's painful, right? It's, again, really bad PR. But if we can have better conversations and say, hey, this is actually a marker of health. This is normal and actually really healthy for you to get your period when you're, at this age. I think that for especially kids that have a lot of anxiety around it, that's a really good way to start that conversation too.
Okay. So I'm doing a good job even though I don't know it.
I mean, you did when we were 8. You told us.
I showed you that video.
Yeah, and then the bracelets.
Oh yeah, right. Yeah.
And you're
So
like,
I
when you get your
donate-
period,
Yeah.
you will get.
Oh no, you got them anyway. Remember? You were wearing them. The Pad Project. So
I do.
once a year I do a fundraiser at my clinic where I donate $5 from every patient treated to the Pad Project, which is essentially providing menstrual products to women in third world countries where they otherwise wouldn't have proper hygiene so they can continue going to school.
Yep.
So we then get these lovely little bracelets, which they're cute. We should get more of those.
Yay.
Yeah, that was good. That was a good move.
Yeah, I don't think we're ever going to have a problem with like periods because we live in the same house as you. So,
Oh,
That's a nice thing to say,
that's
Madeline.
very nice, Maddie.
My God. I did not counsel her on that.
I sort of agree.
Wow.
Like, if I get it, I'm not as scared to be like, I'm not going to tell her. I would just like, if I was invited, be like, Mom, I got my period.
I'd be thrilled.
That's what I would say. I
I've been
won't feel,
waiting
like,
for
nervous.
years.
Yeah. Should we talk about some of the signs that you might get your period soon?
Great. Let's do this.
Yeah. I saw that on the question sheet. Do you girls know any signs that you might get your period
No.
soon? No?
Not at all.
This isn't talked about at school at all?
No.
Okay.
no.
So, do you know what the first sign of puberty is generally?
Pimples?
Acne?
No?
Darn it. I don't know.
Okay. It's typically breast buds.
I don't know what that is.
Ah.
Yeah. So seeing some breast development, some tissue development in that region. Yeah. So that's typically the first sign of puberty. And then about 2 years to 2.5 years after that is typically when a girl gets her first period. And then about 6 months to a year before your first period, you'll probably notice some discharge in your underwear. Have you heard of this before?
Yep.
No.
No? Okay.
At my school, yes.
Aiden, what have you heard about it?
We had this question box, and we had this question box at my school, and one of the questions was about that.
Great.
And since it was in April, I don't remember that much about it.
Mhm.
But I remember they did talk about that a little bit. Yeah.
Yeah, great. So it's just some fluid in your underwear. So it's either clear or kind of like a white color. And it's normal and it's healthy. And I remember when I first noticed some fluid in my underwear, I thought for sure I had an infection. Like I thought something was like really wrong because no one ever taught me about that, right? It's not really talked about in school too much unless someone asks a question, but it's actually really healthy. And it's something that we see about 6 months to a year before we get our period. So yeah. So I would say, and this is what I tell a lot of parents and kids, is that when you notice that discharge in your underwear, that's when it's a good time to start to put together a little period kit. Has anyone talked to you about a period kit yet?
No.
No? Okay. So a period kit, I noticed this was on the question sheet too. What if you get your period at school?
That was my question.
Yeah. What if you get your period at school? That can be kind of, are you nervous about that?
Yes, very.
Yeah. A lot of kids are nervous about that. And so I always recommend putting together a little period kit. So you can do this and just get kind of like a container. You can use like a pencil case or some kind of container that you can put stuff in. Ideally, it's washable, just in case it gets dirty in your backpack or what have you. And so a little kit. And then in that kit, put some pads in there. You can put some hand sanitizer just to wash your hands, not any other part of your body. Yeah, but put some little pads in there and then you can put it into your backpack. So then if you're at school when you get your period, you can just, discreetly take that out, bring it to the bathroom with you and then put a pad in your underwear. Do you girls know how to use pads? A lot of girls actually don't.
Right.
Yeah. We do it in my program that I run. We actually practice how to put a pad on. I mean, with, not actually how to put a pad on, but we do like a little demo on the floor and explain how it all works. Because sometimes we think, okay, they've seen me do it, but a lot of kids actually don't know how it works. So we talk about that. We talk about tampons. And then we talk about Diva cups as well, or any form of a cup and how all those work. That's a more advanced period product. So you'll probably start off with pads.
We are going to the store after this.
Oh, yay.
And I actually
And we're
always
bringing
encourage that.
Ryan.
Yeah.
Oh no, I don't think so.
Poor Ryan.
No, last time Ryan and I went to the store, we got kicked out.
What? Why?
We were videoing in Whole Foods.
No,
They don't
kidding.
allow that?
No.
Oh, good to know.
Who knew?
Yeah.
Ryan apparently did know. I didn't.
But you're their favorite customer.
I know.
How-
I'm still heartbroken
How
about
How could
it,
they
honestly.
do that to you?
Thank you for sharing my grief. Okay, great. Keep going. I'm loving this. This is
Yeah.
amazing.
Yeah, something that we do too. So, typically I say beginner period products, right? It's good for us to know when you get your period, what products should you start with, right? So pads, that's a really common one to start with. Just because once you get the hang of it, it's pretty straightforward. And then another great one to start with is period underwear. Have you heard of this before?
I've seen mums.
Yeah, awesome. Yeah, it's a great product. And it works pretty similar to a pad, but you can wash it and reuse it. So you can put that in your period kit to bring to school with you as well. But I really encourage that period kit because a lot of kids do feel nervous about getting their period at school. Yeah. Do you know if any of your friends have gotten their period at school?
Most of my friends have gotten their period in general and at school.
Yeah. Okay.
Most of
Have
mine.
they really? You're in grade
Mine
6.
too.
No, it's insane.
12 is the most common age.
Interesting.
Yeah.
Oh, no.
No, don't worry. Late Menarche for the win. 14, baby.
What?
Yeah.
Most of my friends, like a lot of mine actually, like most of my friend group, they haven't yet, like before. And so
I'm confused. They haven't
they
yet.
haven't had it yet.
Well, they don't have it
No,
yet.
But some of mine do though.
Then why
So
are there so
they
many
just say-
girls in my school?
Maddie, my whole school
It
is
happened like
girls.
last year.
Have you noticed whether or not, or is there any association with like periods happening younger and younger and what the implications are later in life, if any?
Yeah, so we are seeing that in the research that the average age is a little bit younger now. And there's a lot of different reasons, a lot of different hypotheses about this. So what we know is that genetics play about 50%. So you got your period for the first time at 14. So that's 50% chance that that'll be the same for your girls. And then there's a few other things as well. So distance from the equator is a factor.
Interesting.
Living in an urban versus a rural part of like city or whatever, that's a factor too.
Why would that?
I don't know. It's probably due to in a city we just more endocrine disrupting things in a city would be my
Right.
guess.
Interesting.
Yeah,
So then
but
city
mhm.
populations get
Younger.
their period younger. I
Yeah.
see.
Yeah.
Okay.
Yeah, it's really interesting. So we are seeing that it is trending a little bit younger. Sometimes I talk to parents and parents will DM me on Instagram really concerned about this and say, how can I prolong, the time before my daughter gets her period? And there isn't great research on how we can actually do that. And sometimes I encourage parents to really consider why they want to do that, right? Like we do know, there's some health implications later on in life if you started your period earlier, if you started menopause earlier or later, then that can be a factor in some things.
Right.
But overall, I tend to tell parents to not stress too much about it and to just continue to approach these conversations with their kids, encourage them to, keep those lines of communication open because I just don't want to create any more anxiety
Right.
for parents and for kids, especially when the research isn't incredibly clear.
I find too, though, it's interesting the way that women will relate to their mothers in like a period of fertility and then a menopause setting.
Yeah.
And it was interesting. My mom had a very negative view around periods, pregnancy, and then her menopause scenario was one that I am still traumatized by today.
Yeah.
I'm sure my sister will agree. And she had like massive fibroids. All of her sisters had fibroids. And it was this, wait for your fibroid scenario. And it throughout so much of my teen and then even when I had kids, this concept of like, okay, well, you only have one ovary, so it's going to be hard. But also we have a family history of getting fibroids.
Right.
And I very much determined after I lost that ovary, like I was going to be taking charge of my menstrual health, my reproductive health, and there was going to be no fibroids, which is obviously not entirely up to me. But I do think it's interesting that I took a very different lifestyle approach. And so I think a message that I wish more people understood was that you have a lot more control. And I want people to lean away from this. Okay, well, inevitably, my mom had this and therefore so shall I.
Yeah. Because
I think we're learning more and more that the epigenetics are a huge factor. What is that saying? It's like you may your genetics may be the
I was going to say the one genetics load the gun.
Yeah,
epigenetics pull the trigger.
Yeah. Right.
Yeah.
And I feel like that definitely plays
I totally agree.
a role,
Yeah.
in your reproductive arc.
Yeah.
If you will.
Absolutely.
And so it's interesting that 50% is determined and it's only 50%.
Yeah, only 50%.
Yeah.
Yeah.
Okay. That's helpful.
Yeah.
Okay, great. That's great. What kind of symptoms are most teens nervous about?
I think the pain is a big one. Would you girls say that's accurate? Is that what you're most worried about?
Yes.
Well, symptoms, pain. I mean, Kind of, but I'm most afraid of the blood.
You're most afraid of the blood. Okay, I think that's actually a great point. And I think that that's something that more parents should be talking to their kids about too. Because before girls are menstruating, the only blood from their body is when they're injured. And so that creates kind of a negative connotation with a menstrual bleed, right? Like, is it a cut? Am I bleeding? Is this wrong? Is this bad? Like, that can be kind of confusing, right? Mm. Yeah.
Is that what he said?
Yeah, I was like, Maddie, it's a lot of blood. It's a lot. Not
Honestly, that might be my fault, as I may or may not have been trying to get out of certain things, which you will learn about later. But I'll bleed for weeks, months. The last 2 years. Poor stepdad.
So it's actually we'll revisit that
The
conversation in a
best.
few
Yes,
years.
yes.
So
They'll
when
die
it comes,
in a few years.
Yeah.
This is what's gonna happen.
So when it comes to actually the amount of blood, I think that it's really important that we talk about that. And we go through that. I do like a little demo of exactly how much blood in the program too, because that's a big question. It's actually, this can be, I wish we had like, do we have tablespoons here?
I have like a little coffee cup. Obviously, I always have a little coffee cup.
So can you girls picture the size of a tablespoon? Yeah, kind of like that. So the amount of blood that you lose during a period is actually only 4 tablespoons. So it's about 60 milliliters. When you put it, and that's over the course of the whole bleed. So most girls and women bleed on average about 5 days or so. So that's over 5 days. You're only losing 4 tablespoons amount of blood, which is actually not that much, right?
Wait, does that mean I have to eat more? Because like when you're like bleeding a lot, doesn't that mean you have to eat more?
That's a great question. You don't need to eat more, but what you do need to be mindful of if you're getting your period and if it's a lot heavier than that. So if you're noticing that it feels like you're losing a lot of blood, which does happen to some girls, then you do want to get an assessment done and just make sure that you don't have like low iron or something. Because if we lose a lot of blood, then we can become deficient in iron. And then you might need to eat up a little bit more or supplement a little bit more. Yeah, but that's a great question.
Okay, great. What
Mhm.
happens if you know, a patient comes in and they're bleeding significantly more than that?
Yeah.
How are you gauging what is appropriate versus not?
Mm-hmm.
And how does that change through one's reproductive years? Like, is what they start out with, for instance, is that going to change?
Mm-hmm.
Or is it going to remain roughly the same?
Yeah, that's a great question. So for the first 5-ish years, 3 to 5 years, often when girls start menstruating, their cycle can be a bit irregular. And I think a lot of parents aren't aware of that there can be some irregularity. Some girls are regular right from the start, and that's great. But for other girls, they can their cycle, the time between their bleeds can be a little bit shorter or a little bit longer. They might skip a month. And right at the beginning, that tends to be normal. It's not too much of a cause for concern.
It's actually alarming how many patients come to see me, and
Yeah.
that was the reason they were put on the pill,
Yes.
is that it was because of irregularity in their
Yeah.
cycles
Yeah.
at the age of 14.
Yeah. And that's like,
Stunning.
honestly, it breaks my heart because why aren't we digging a little deeper, right? If there's that much irregularity, we do, once a girl gets her period, we want her to bleed at least 4 times a year. And so if it's more irregular than that, we should be investigating, right? What's going on here, right? Is there maybe PCOS? Is there over-exercising or undernutrition that's causing, a girl to lose her period? And so I just, obviously the pill can be a great solution for certain things, but when it's a blanket for everything, I think we're in dangerous waters, right?
Same.
Yeah, I don't think that's, I think we're doing girls a disservice when we just slap that on every gynecological issue that they have.
Yeah. Because
Yeah.
then you end up not knowing what, and I don't even like when people are like, oh, I wish that I had not been on the pill.
Mm-hmm.
Because then when I wanted to have a baby, like even though I'm in fertility, that is my primary patient base, I badly wish that people cared about their periods for themselves.
Mm-hmm.
And wanting to get reasons for why things are not working before they want to have a baby.
Yeah.
Well, what if you never want to have a baby?
Mm-hmm.
You know?
Yeah.
That's okay too.
Yep.
And you should be getting a quasi-regular period
Yeah.
that's not rendering you,
Yeah.
bedridden,
Mm-hmm.
as that is problematic.
Yeah.
So are there certain supplements that you would recommend for teens
Mm-hmm.
or tweens who are having, certain concerns? Or is there, as part of your menstrual period kit,
Mm-hmm.
do you also have I hate when people ask me this, but a generic, pharmacy, if
Mhm.
you will, that is more of a natural solutions pharmacy that could apply to both tween, teen, but potentially also the growing adult?
Yeah, absolutely. I mean, of course, it always depends.
Obviously.
But, a good one to start is magnesium. And that, especially for a lot of young girls, I find if they're having cramps around their period, magnesium can be very, very effective. Another one that has great research is ginger. So dosing that right before a girl gets her period. If it's regular, of course, that's a little bit easier to start dosing. But even if it's not, you can still start right when she gets her bleed and then dose it. And that actually has a lot, I'm sure you know, such great research for helping reduce menstrual cramps. And then other things too, like nutrition can play a big role as well. And then, of course, things like acupuncture can be very beneficial for menstrual pain.
Good thing you're an acupuncturist.
Good thing. Good thing.
It's almost like you knew.
It's something like that. Yeah.
But it is very effective.
Well, the thing is, I think it's really important if they learn to use more natural solutions in combination.
Yes.
With, I like to use, even in my practice, ask your physician for X, but in the meantime, we can address the root with Y. So, maybe you're magnesium deficient, so you're getting more cramps. So you'll take magnesium as an ongoing.
Yep.
And then you can take Tylenol, Advil, whatever is your preference.
Yep.
For the immediate acute pain.
Absolutely.
And then we're hoping that you then don't necessarily need it every month, but you can start trying to be proactive and then you're not scared of your own body.
I think that's the biggest thing, right? Yeah. We have to learn our own bodies. And, I just think that for a lot of girls and women, we don't until fertility.
Right.
That's when we really take an interest in the way that our body is working. And are my cycles regular? I've never tracked that before, right?
Yeah.
And I mean, I'm sure you see this all the time. People are really disconnected from their own bodies. They don't understand the way that things work. And you were sharing about the fallopian tubes. And when I'm teaching my program, so many of the moms, just even as simple as explaining what a menstrual bleed is, right? Like the shedding of the uterine lining and going through the diagrams. So many of the moms are like, wait, go back. So it's the shedding of the uterine lining? Oh, okay. And then, that's where the cervix is? Oh, right. Oh, okay. Like no one taught us these things about our bodies, right? It's funny. It's the moms, there's so many aha moments for them as we're going through very basic puberty education because it really wasn't taught.
Right.
Yeah.
No, that's so true. Even now, when a patient will come in and they have, for example, a very light menstrual period, they're stunned that I then asked them to go and have their estrogen and their iron tested.
Mm.
They're like, well, why would that be related to my lining?
Mm-hmm.
I'm like, oh my God.
Mm-hmm.
Because your estrogen is what helps the lining grow.
Yeah.
And they're like, what?
Yeah.
And then you have to explain ovulation.
Yeah.
And then, you're backing all the way up. When I explain, like, people will come in and they're scared because they're looking at their ultrasound. They've been given now their report.
Mm-hmm.
They're reading at the bottom. They're like, I have a corpus luteum cyst. I'm like, great.
That's what we want to
Don't
see.
worry about that. We need that.
Totally.
They're like, are you sure?
Mm-hmm.
It's under observation.
Mhm.
I'm like, yes,
Yeah.
I assure you.
Yeah.
It is what's producing your progesterone.
Yeah.
They're like, oh.
Yeah. We really, I
Oh.
mean, I learned so much of this studying to become a doctor.
Right.
Like, it shouldn't be that hard to access information about our own bodies. Like, it's tough. And a lot of women don't know these things. And so it makes it really challenging for them to teach their daughters these things and have these conversations. And I think a lot of parents just get really overwhelmed with
Right.
learning all this and then relaying this important information to their kids. It's really challenging.
Yeah.
Yeah.
It was interesting. Their reaction to talking about like fluid in their underwear
Mm.
was like, you could see in this one in particular, her like extreme like discomfort with it, which is so interesting because now as part of my assessment, something I quickly will ask, any cervical fluid?
Mm.
What's the color and consistency? And my patients squirm.
Mm-hmm.
There's like 28-year-old women, 29, 30-year-old women like squirming at the idea of me asking them flippantly about their cervical fluid.
Yeah.
And I've switched it to fluid too, because when I was asking about mucus, oh my God,
Mm-hmm.
look at this mucus, Madeline. Like, it's
But really, who's talking
so
about this?
horrifying.
Yeah.
I'm like, it's not. This is part of like, you have mucus membranes.
Mhm.
Like, this is part of it.
Yeah, it's healthy.
It's great.
Yeah, it's
We
getting
need
rid
it.
of bacteria. It's so healthy, but who is talking about this, right? Really nobody.
Yeah.
I remember the first time that I heard about this. I had noticed it in my underwear. And again, I thought, I for sure have an infection, but I cannot tell my mom because I'm way too embarrassed. And I was at a sleepover. This was maybe like grade 9 or so. And we were all in the dark. We were going to sleep. And then one girl's like, hey, I have a question. Has anyone else noticed some white stuff in their underwear? Is that normal?
Oh
And
my God.
I was like, oh my God, it's not just me. And that no one had mentioned that at all to me before that. And it was like huge weight off my shoulders. I felt so empowered and just normal knowing that, okay, other girls have this. Okay, I'm okay. Right? But who's talking about this? Right? Nobody.
We're going to.
Yeah.
That's what it is.
Yeah.
At school, when someone asked that question, because I did have that before, and I was like, oh no, am I going to die or something?
Of course.
But then when someone asked that question, I was like, oh, thank heavens.
Yeah.
You thought you were
And
going to
then-
die.
Yeah. And then my teacher was like, oh, yeah. She answered the question. She was like, oh, yeah, it's totally normal. It's good. And I was like, oh, I'm not going to die.
Right.
Yeah, but we got to be talking about this. And especially because typically when you see that, your period is coming in about 6 months to a year, right? And that's good information
Great.
for girls and for parents to have.
Right. Great. Well, we're going to the store after, so we'll be ready.
prepared.
You're making a period
Ready.
kit.
How much do you discuss ovulation?
When I talk to tweens, not too much. I find
Interesting.
that it goes a little over their head at
Right.
this age. We have some interest in creating a teen program.
Right.
So I have a lot of content created for that. So eventually, when the time is right, we'll launch that. And in that program, I'll definitely talk more about that. But with the tweens, I find that they just don't have anything to like root that in just yet.
Right.
So it's a little bit confusing at that stage.
Okay.
Yeah. But definitely an important conversation to be having.
Yeah, I think that is something that I wish that we could just start with, because so much of the dysfunction, that's where it begins.
Absolutely.
And I think if we had more healthy respect for our ovaries generally,
Yeah.
and like understood that they were sort of the metronome
Yeah.
of the entire cycle, you know, from a pelvic perspective, like not taking the brain out of it, obviously, but like understanding the role of ovulation.
Yep.
And then understanding, for instance, like what the birth control pill is even doing.
Totally. Yeah.
And like why it could benefit some women, but could potentially make other women have more, or, you know, for instance, like just, this is going to go over their head 100%, but I had a patient today who was told that she would benefit by taking estrogen because her lining was thin and she was already on day 9 of her cycle. This patient in particular has like a health history, which also involves factor 5. And she has a history of pediatric stroke.
Wow.
So it was obviously recommendation. I was like, please do not take any synthetic estrogen.
Yeah.
As that is going to lead to potential clotting.
Yeah.
That is not appropriate for you.
Totally.
But she had no way to advocate for herself because she didn't understand the role of estrogen in thickening the lining, the role of estrogen in blood, and then the role of overall like well-being and how it's all connected. So I think having that context would be hugely helpful from even like a PCOS standpoint.
Absolutely.
There's like so much missing from that conversation.
Actually, so I just had a conversation similar with Michelle recently. And so we also run women's health programs, the Wild Collective.
Yes.
And we were talking about, so the first module is all about the menstrual cycle for women. And Michelle was just saying, she's like, maybe we need to rename that module to the ovulatory cycle.
Right.
And maybe, because that's the main event, right? Like maybe we need to be framing this conversation as this is the thing. And let's talk about what might go wrong there and how we can, just all the things you said, right? And women don't know that. Women don't know that.
Well, even like the luteal phase.
Yeah.
They're like, oh, my period is late. I'm like, well, when did you ovulate? They're like, well, I ovulated late. I was like, well, then your period's not late. Right on time. Like, that concept of it being like max 14 days. Yeah. You know, you don't have anything producing progesterone after that. Yeah. You know, unless HCG is in your system and them having no clue.
No clue. Yeah.
About that.
Yeah. Absolutely. Something we actually do in the tween program is go through the 4 phases of the cycle.
Right.
And the way that I do it with kids, so a lot of the girls in the program haven't got their period yet.
Right.
And so the way that I talk about it, you know, I talk about the different feelings that you might experience in the different phases of your cycle. And, you know, maybe you don't have your cycle yet, but there's been times where you feel really energetic and really excited and you want to get out and be friendly and do all the things, right? And so when we can still take a lot of those feelings that we all experience, whether or not you have had your menstrual cycle yet, and relate that to the phases of the cycle. And then we go through and we do charades and we talk about how if girls are feeling the ways that they may feel in the different phases of their cycle, how their mom can best support them when they're feeling that way. And then we swap. And then we talk about if the mom's feeling like that, how the girls can best support them. And I think like that's another piece that a lot of women don't realize either is the 4 phases of the cycle.
Right.
And the different levels of energy and feelings and all the things that are quite normal based on our hormones. But again, who's talking about this, right? Is this talked about at all in school? The phases of the cycle?
No.
Yeah. I would be surprised if it was.
In my school last year, they didn't talk like a lot at all, actually, about periods, like at all. So
They just
nothing-
dealt with consent
no, yeah, they just dealt with like pregnancy
and
stuff.
your
And I was-
also
and
your
then-
boundaries.
And then all the boys were like, ah, and screaming and like, I don't know, they were being weirdos with their red faces and stuff.
They're lunatics.
This
Oh.
year, I actually watched a pretty funny video about consent.
Right.
With the teeth.
with- Yeah, the
Yeah,
tea
that one.
consent.
What is this tea consent?
It's like if you ask somebody to if you ask somebody if they want a cup of tea and they say yes, you can make them a cup of tea.
And then
But
it's
if
like,
they say no, don't make them a cup of tea.
or
If they're unconscious, don't make them a cup of tea. Unconscious people don't drink tea. Don't force the tea down their throats.
Wow.
And
Well, they said
other
that bit, eh?
things.
it was like
Yes, yes.
violent-ish.
Right.
They were like, if the person is sleeping, do not give them tea. They would not like tea.
Don't
because
force them to
that
drink the
will
tea.
Probably hurt their throat. That's what they were.
If they don't want the tea, don't force them to drink the tea.
I mean, it was a
That's-
pretty good video.
I like
We
this.
can show it to you later.
Yeah.
In my new school,
funny.
it's a lot of it. Like there's so it switches between PE and health.
Yeah.
Health was like for like 2 months.
Right.
Everyone hated it. I was interested because I wanted to know more. So then, when they were talking about periods, because it was like all about periods, and everything's gonna be all right. If anything was happening to me and I was nervous, so I was fine with that. But then I was looking forward to PE again.
Right.
Mine was mental health and tea.
And I see.
And tea.
And tea.
And tea. And that's the tea about that. Okay.
Yes.
Do you two have any other questions, qualms, concerns?
Most of my questions are answered because prior to this, I let her look at my questions, and a lot of them were actually answered. So now I'm feeling much better, and now I know more about it,
Good.
and I don't really remember some of them, but most of them were answered. Yeah.
Great.
I have 2 questions.
Okay.
First, if my sister gets like her period at 13, will it be like affected by me, and will I also get it sooner?
Not necessarily. So there is some, like we said earlier, there's some genetic component. So if, let's say your sister gets it at 13, there's maybe a 50% chance that you'll get it at 13 as well. But again, when you notice that vaginal discharge, you can use that as a pretty good indicator of, okay, in about 6 months to a year, that's when you can expect it.
And also, do I have to wear pads at night?
Great question. You do. Yeah, when you're on your period, you will, because you'll continue to bleed through the night.
A
I
special night
had a
pad or something?
Yep. There's ones that are thicker, and then there's ones that have wings. And so you can wrap that around kind of the bottom part of your underwear to make sure that it really stays in place.
I had a
Yeah.
question. Will the period change me?
Hmm.
Will it, like,
What do you mean by that?
I wanted to know, is it gonna like change my mood? Am I gonna be
Well, that was my
more
question.
depressed or sad or something?
That's
Or
a great
angry?
question. Not necessarily. So, yeah, this is a great question. So, I think a lot of times we associate the mental emotional changes that happen during the tween years and the teen years with our hormones, right? We hear that a lot. Oh, she's hormonal, right? We hear that. But actually, what the research shows is that in the tween and the teen years, it's actually more of our brain development that's causing a change in our emotions. So as you get more into your teen years, your emotions are going to feel a lot bigger and more intense. And that's actually normal and healthy because our brains in these years are restructuring a lot. So the part of our brain that's associated with big feelings and big emotions is really active, and it's developing and it's changing actually a lot. So that's actually why feelings feel really big in the teenage years. So it's less to do with our hormones, and sometimes that can play somewhat of a factor, but it's actually usually more of the restructuring in our brain. And that's all normal and healthy. And I think it's also important for parents to know that. Sometimes they can feel overwhelmed, and sometimes for good reason, right? As their kids are going through these stages. But developmentally, it's actually really healthy for kids to have really big feelings. Sometimes when I'm talking about mental health with parents, a common question is, okay, when do I worry about my kid's mood, right? And on the one end, if your child isn't having big feelings, that's cause for concern, because that's really healthy and normal for your kids to be experiencing, highs and lows and how they're feeling during these years.
So now we got rid of the kids.
They were great. They really were.
They really are phenomenal humans. Yeah. That was tremendously beneficial in terms of like my prep and what I need to do.
Good, I'm glad.
Because now I shan't procrastinate on the getting them of a period kit from both the, naturopathical capacity as well as the actual menstrual hygiene that they will require. Funny, my friend Joanne, she actually owns this company, Nix.
Oh yeah.
Yeah.
Awesome.
I think she sold it now, but like she started it, and one of the brands that they have was this teen underwear. And I felt it was interesting because they didn't have very much targeted media compared to the adult brand.
Right.
And I always wondered about that, and like whether or not if we just started making it more of a conversation, like from that, 10 on.
Yeah.
And it became like better understood in both like Madeline's co-ed school, but also like single sex school. And I'm wondering, like my son goes to an all boys school. Like, will they address menstrual cycles at an all boys school?
Probably not.
I hope that they do.
I hope they do too.
Because that would prevent them from becoming like a significant population that I deal with, which is men who are so disconnected from the fertility process.
Yeah.
Like to the point where they barely feel like they have anything to contribute.
Yeah.
Even when it's 50%.
Yeah.
So I feel like if the more conversations we have like this, like starting from the ground up, I think the work that you're doing is so important.
Thank you.
And it's particularly of interest to me. I didn't even think that it was something that we would need to be having a conversation about now, like 2024, because I thought by the time I was 40, after graduating from high school, I thought by now it would be barely an issue. But it's interesting to see that needle has almost moved not at all.
Yeah.
Like I also went to an all-girls school, and I won some like young alumni award back in 2020.
Cool. Congratulations.
Thank you. But it ended up being such an annoyance because they asked me what I wanted to speak on, and I wanted to discuss to the population that goes there, which was, the upper school, which I think is grade 9 through 12. So like 14 to 18. I wanted to discuss reproductive health.
Right.
From an ovulatory standpoint, like fertility.
Oh, that'd be amazing.
But they wouldn't let me.
Yeah. A lot of red tape. Yeah.
Which I thought was so insane. Like you have such little respect for these 14-year-olds and you would rather keep them in the dark about information that is currently very applicable to them.
Yeah.
Like even in your own personal example and with Aiden as well, once you give an explanation as to why a process is occurring, it no longer makes that process scary.
Yeah, exactly. We're demystifying. Yeah, and that's what girls need. That's what we all need.
This is
in
what
every
women need.
aspect of our life, right?
Yeah.
Yeah.
And so instead of this like blanket ignore, mute, we could potentially turn it up and make it something more interesting.
Absolutely.
Even Nix right now with the Olympics, they're doing like women in sport and how many women at the Olympics right now are on their period.
Yeah.
And how important that is.
Yeah.
To both give context to like, you shouldn't be in this much pain. These women are competing at an international level. Like how are they getting there? And yet there's other women where it's acceptable that they're, hospitalized for endometriosis pain.
Yeah.
And how is this acceptable across, both spheres?
Absolutely.
Anyway, this is a conversation for another day, but I just wanted to like acknowledge you and thank you so much for your work. I hope you keep going
Thank you.
and like move beyond even just the ovulatory to beyond for these young minions,
Absolutely.
And I hope you'll come back.
Yeah, I'd love to come back. This was so fun and they were great.
I mean, next time we won't bring them as their mother.
They
just
were so fun.
they're fun. Watching them fidget, I'm literally like, do you have magnesium right now? Do you have some magnesium on you? Can we give it to
They're
them?
great.
in
Such
a
great
massive
questions.
quantity?
Very thoughtful questions they asked.
They're very thoughtful gals.
Yeah, they are.
Yeah.
And thank you for having me. I had so
God.
much fun. I just love talking about all this.
God. Yeah, we'll have you back.
I'd love that.
Okay, great.
Great.
Thank you.